Good morning, students. This last lecture will be about the developmental malformations and about the twinnings. The twinnings is always an exciting topic, and here you see two quintuplets, and if you see this set of quintuplets, within this one set you have twice monozygotic twins and a third sibling which was produced from another egg cell. With these guys, I never know which two of them are similar, so you can choose. But first we will talk about the congenital malformations. The traditional name for this was the teratology. The term teratos means monster. So it doesn't sound a very delicate term. And the origin of this term, teratology, is that in the previous centuries there was no way to diagnose a malformation which didn't show on the surface. And the ones which were visible from outside, they look sometimes very strange. If you look at the numbers, that how many % of the newborns have some kind of a malformation, you will find very different numbers. Also about the occurrence of the malformations. Why? Because some malformations, though they occur, but they are never born because they are not compatible, not even with the intrauterine life. And there are some malformations which are compatible with intrauterine life, but the baby doesn't survive because it has major malformations and cannot live on its own after birth. Or the third thing what varies these numbers, that not all malformations are detected. So some malformations, like for example the kidney malformations, may be undetected throughout the entire life. Though the people who have some kidney malformations, they have often kind of kidney diseases, but not every one of them. So it may be that it doesn't produce any symptoms, and then you do not know that the patient had or the person had a malformation. But what is in the background of malformations? There might be environmental factors which influence the growth of the embryo and the fetus. I will show you a table about that for you in a minute. There are genetic mutations. These may be dominant or recessive. You might have learned about this more in biology. And there are chromosomal factors. These may be numerical and structural abnormalities. And there may be intersexuality problems without numerical aberrations of the chromosomes. Disruptions and deformations, I will explain these terms then later. And some maternal diseases may influence also the growth of the embryo and the fetus. Of course, in this 20-minute period, I cannot give you a full survey of the possible malformations, so we will give you just examples. And in the exam, you will have to know that what are the types of the malformations, and you have to be able to give examples for each of them. So what these environmental factors may do, that depends on the time. Right after the fertilization, there is kind of like an all or nothing rule. So the specific environmental factor may either kill the zygote, or the zygote will survive without any problem. If there is a malformation, that mostly occurs between the 3rd and the 8th week. So this is the most sensitive period in which all major organs are established. Some of them, they also finish their development, like the heart, it finishes on the 6th, 7th week, its development, or the limbs also. With these noxa, these environmental factors, these harm always that part of the body which right then develops at the fastest speed. So here you see with these blue lines which are the organs which develop in that specific period. After the 8th week, most of the organs are already established. Minor malformations may yet occur, except for the central nervous system, which is developing until your birth, and I hope that you are able to produce some changes in your nervous system even now, not morphological, but on synaptic level, and you may be able to pass your exams, all of your exams in this semester and in your future studies. What are the factors? What are these environmental factors? It may be infections. For this, we have this abbreviation, TORCH. The T stands for Toxoplasma infection. Others, many other viruses may produce a malformation. From these others, it's worth to mention now the Zika virus. You know that in South America it's quite common now, and it causes microcephaly, rubeola, cytomegaloria, and herpes. So these are the most frequent problems, and the others shows that many other viruses may occasionally, they may also do some harm to the developing baby. There are the ionizing radiations, including the X-rays, and of course any radiation that comes from your surrounding. Chernobyl was an example about 35 years ago, which caused a major problem in the surrounding and gave sad and obvious examples for that radiation influences the fetal growth. Chemical agents. The chemical agents may be drugs, like drugs for pleasure, or drugs like prescribed by doctors. Some of the medications that are given by doctors, they are harmful for the baby. From some of these, it is known that they are harmful, and they must not be given if the person is pregnant. And some of them are not yet fully examined. If you see the description of these medications, then it says that pregnant women should take it only under control of doctors, and they shouldn't take it on their own or so. And this doesn't mean that obviously they will produce a malformation. It just may mean that it's not fully examined whether they are interfering with the growth of the in utero baby or not. Vitamins. Pregnant women are advised to take vitamins, a special combination, but for example, if they take not enough vitamin A or if they take too much vitamin A, both may harm the development of the nervous system. So pregnant women, they always should take that specific combination of vitamins which is designed for them. Alcohol, we already mentioned that it interferes with the gastrulation and with the development of the nervous system. Environmental pollution, that's a major problem nowadays. And if we take the environmental pollution, then there is this plastic, small plastic pieces, tiny, small micro pieces, about which you may read nowadays a lot. And also the degrading plastics, they may produce molecules which are so-called endocrine disruptors. With these endocrine disruptors, we go over to, it's not exactly a malformation in that sense that it causes a morphologic problem, but if the mother during the pregnancy is influenced by these endocrine disruptors, then it may do a modified priming for the endocrine system of the baby, and it may influence, for example, the sexual development. So we must take care of our environment, and you must be very conscious about this because it has a long-lasting effect. Just think about it, that plastics, we haven't used plastics for a long time, we have used them only for about 60 years, and in 60 years we did such a big harm to our surrounding with this. Hyperthermia is may be also a problem. This may be a fever accompanying a disease, or it may be also sauna, which is not healthy if a pregnant woman stays in sauna, which has very high temperature, because the core temperature may also increase, and this increased temperature may cause also malformations. We may have genetic mutations. These may be dominant or recessive. There are plenty of examples for that. Here now I will mention only two of them. The hemophilia, and the hemophilia is a disease which is carried by the X chromosome, and if on the other side there is not a healthy X chromosome, then it will show, the disease will appear. And in case of males, the Y chromosome doesn't have this small part, which is responsible for blood clotting, so then these males will be hemophilic. Women may be hemophilic only if they get a bad X chromosome with these bad genes from both sides. Or the phenylketonuria. Phenylketonuria, these people are unable to break down phenylalanine, And these metabolic products which occur, they damage the nervous system. This has to be diagnosed right after birth, because if these babies, they keep a proper diet, due to the proper diet, they will grow up to be a healthy adult. But if they don't keep the diet, and if it's not diagnosed, then of course they don't think about keeping the diet, then the nervous system will be harmed by these metabolic products. We have chromosomal factors. These chromosomal factors may be numerical abnormalities and may affect sex or somatic chromosomes. So if we think about the sex chromosomes, in males, what appears that may be the Klinefelter syndrome, XXY or XXXY. So it's a supranumeric X chromosome due to non-disjunction during the meiotic divisions. In female, also due to non-disjunction, better to say there are persons who have Turner syndrome who have just one sex chromosome, one X sex chromosome, and we do not know what was lost, an X or a Y. But these people with the Turner syndrome, they appear to be women. If you look at the phenotype, they are small stature women, but they are kind of female. They have kind of female characteristics. This is the only possibility when someone may survive with only 45 chromosomes, so the Turner syndrome. Or the superwoman, they have more X chromosomes, 3 or maybe 4 X chromosomes. They may ovulate occasionally. And it's a special case if due to non-disjunction, right, or monozygotic twins, one may have a Turner syndrome because this X chromosome moved to the other cell during the separation of the twins, and the other may be a superwoman. Or it may happen also that a zygote starts the life as an XY male zygote, and then from one, as it divides to be a monozygotic twin, from one side the Y chromosome is lost, so then you end up with a healthy X and Y boy, and on the other side an X0 Turner syndrome person. I will show you examples for this now. This is the Klinefelter syndrome. So in the case of Klinefelter syndrome, these are tall males and the shoulders are not very wide. They have gynecomastia, so they have kind of breasts, micropenis, and genuvalgum, knock knees. This is characteristic. These are the characteristic features. They are usually infertile. And if you look at the karyogram, in the karyogram there are 2 X chromosome and a Y chromosome. And also, if you look at the neutrophilic granulocytes, in the neutrophilic granulocytes there is a small process on one of the mature segmented neutrophilic granulocytes. This is the so-called sex chromatin or drumstick. This is the sign of an inactive X chromosome. If someone has more than one X chromosome, then the one which is not active, that will form this drumstick on the nuclei of the neutrophilic segments, that it is very easily detectable. So that is, of course, with all women, because women have one inactive X chromosome, and in males who have more than one X chromosome, like the Klinefelter patients. And on these pictures you see Turner syndrome individuals. As I told, they are of short stature. They have gonadal dysgenesis, so they don't have germ cells in the developing germ cells in the gonads. They just have the connective tissue part of it. They are of short stature. They have a so-called pterygium colli. That's a webbed neck. There is a skin fold on the neck. They may have lymphedema. They have a flat, broad, shielded chest. And you see that the mamillas are standing wide, far from each other. And they may have a low hairline. It's also typical that the elbow is in this abducted position. This is the in the valgus position, so it's kind of like an angle outward. And we have then the somatic abnormalities, like the trisomies. This is also due to non-disjunction during the meiotic divisions, occasionally just after the fertilization during the first mitotic divisions, it may also happen. And the most typical one is the 21 trisomy. That's also called the Down syndrome. This is how the Down syndrome patients typically look like. Their eyes are a little bit obliquely positioned. They have a skin fold in the medial angle of the eye. They have also a little bit deformed ear. And many times their mouth is open because their tongues are too big. So they have macroglossia and they cannot close properly the mouth. They may have also umbilical hernia. And they have this transverse fold in the palm, Shimian fold, it's also called. But this is, if someone has this, it doesn't necessarily mean that has Down syndrome. It might be a sign for it, but if you see this, then you have to go after the problem, whether it's accompanied by Down syndrome or not. Healthy people, healthy, clever people, may also have this special transverse fold in the palm. And yes, the Down syndrome usually goes with mental retardation. Better to say, the mental capacities may vary. So there are some who are pretty well functioning and pretty clever, and they can finish schools and they can go along in the everyday life. And there are some who have stronger disabilities. The trisomy 18 is called Edwards syndrome, and the trisomy 13 it's called Patau syndrome. These are more severe problems. Usually these children don't survive the first year of life. They have serious problem with the heart formation, with palate, with the lips. So they may have cleft palate and cleft lip. And they have multiple problems, nervous system problems, limb development problems, as you see. Occasionally, they survive. Those are the milder cases, like this woman. And she couldn't speak properly, so it took her at least 15 years to be able to explain to the surrounding that she is not mentally disabled. She cannot communicate through the usual ways. And so you must be careful with patients who cannot communicate, because it's not sure that they are mentally retarded. It might be only that they just cannot speak properly. So, structural abnormalities of the chromosomes, that may be microdeletion or partial deletion of a chromosome. To this group belongs the Credesha syndrome. Here the short arm of the 5th chromosome is missing. Or the Prader-Willi-Engelmann syndrome, that's a problem of the 15th chromosome, and it's different in males and females, the appearance of the patients. You will learn about that later in pediatrics. For the Credesha syndrome, I have a picture here. The Credesha name comes from that cats cry disease, because these children, they cry on a high-pitched voice because of laryngeal malformations and nervous system problems. They are also mentally retarded, and their development is slower, so they grow also slower. And the problem is, as I told you, that the short arm of the 5th chromosome is missing. We may have intersexuality problems without numerical aberrations of the chromosomes. The term hermaphrodite, probably you know from your everyday life. Now we will use this word in the medical sense. There are true hermaphrodites, hermaphroditus verus. That's an extremely rare condition, and usually these patients, they have normal set of chromosomes, and they usually have 2 X chromosomes as sex chromosomes. There are only a few hundred proven cases described in the literature. So as I told you, it's extremely rare, and they have both male and female characteristics, and in the gonads you may find also both types of tissues. The more common problems are the pseudo hermaphrodites, and from these we have also 2 kinds. Pseudo hermaphroditismus masculinus. In this case, the sex chromosomes are X and Y. And the gonad is testis, but the phenotype is female. How may this happen? So that this is a good functioning testis, but as it produces also testosterone, but on the periphery, the tissues do not react to testosterone because of the lack of proper receptors. This was also called Morris syndrome earlier, or today it is the most common name for this problem is androgen insensitivity syndrome, AIS. These people, they appear as perfect, pretty women. They are many times very beautiful women and athletic women. And the problem is only that as they produce testosterone, but they don't have receptors for that in the periphery, and because of this, because of the estrogen dominance, they will be, the external phenotype will be female. The other possibility is the Pseudo Hermaphroditismus femininus. In this case, the chromosomes are XX, the sex chromosomes. The gonad is ovary in this case, but the phenotype is male. Why? Because the suprarenal gland has a problem. You know, suprarenal gland cortex synthesizes steroids. That's a very long biochemical process. You will learn it in both physiology and both in biochemistry, over 20 steps, and each step requires a special enzyme. And if there is a block in this series of steps, then the previous product will accumulate, and these products through the synthesis, they have a mild androgenic effect. And if there is a big concentration of mild androgens, right, the strongest androgen is the testosterone, but if you have a lot of mild androgens, that will bring the external appearance in the male direction. So because of this problem with the suprarenal gland, it's also called adrenogenital syndrome. Now, I told you that I will explain this term disruption, so that may also cause a malformation. Disruption may happen due to a vascular accident. About vascular accidents, we already spoke in connection with the Contergan. You remember with the limb development, I mentioned that in the 50s, 60s in Western Europe, there was a big problem with this medication, which was advised to be taken by pregnant women for morning sickness, exactly in the period when the limbs develop. And many times the vascular channel, the main vascular channel of the limb was closed, and then they ended up with a limb atresia. Or it may happen that a blood vessel which runs to a certain segment of the bowel has arterial system, kind of like radial arteries running out from a central stem of the artery, and if one of these main arteries is closed, then it may happen that a piece of bowel doesn't get enough blood supply, and it will die off, and because of this they end up with a bowel atresia. Another possibility are the amniotic bands. Amniotic bands themselves are not normal if they form, but sometimes there are kind of strands stretching through the amniotic cavity. And if the baby moves, may be tangled up in these amniotic bands, and these bands may even amputate a limb in the early phase, or later damage these smaller outstanding parts like the finger. So this is just a mild indentation here on the finger, so that's not a very big problem, but here you see stronger problems due to these amniotic bands. Deformations. Deformations due to mechanical forces. The baby doesn't have enough space to move, and it's squeezed into a small territory, and due to this compression, then malformations may happen, like, for example, the clubfoot. Earlier, this was a more serious problem because there were diseases which damaged the structure of the trunk and of the pelvis, like also the tuberculosis or the syphilis, for example. And there were women who just didn't have enough big space to let a baby develop, and their pelvic structure was severely damaged. There was no contraception, so if they got pregnant, then the babies were at a real risk due to lack of space. Of course, many times they also died during labor, both the child and the mother, because the baby just couldn't get out from the pelvis. So that was a severe problem. Nowadays, this lack of space is mostly due to oligohydramnion. What does this mean? That there is little amniotic fluid. Why may it happen that we have little amniotic fluid? It may leak, so the leakage of the amniotic fluid alone can cause that there is not enough fluid around the baby and the baby cannot move freely, and they may end up with clubfoot. Or oligohydramnion may occur also then when the baby doesn't have a kidney. The babies, they swallow the amniotic fluid and they recycle it, so to say, through the functioning kidneys from the 5th month on, and they pee it back to the amniotic cavity. And if there is no kidney, then this recycling doesn't function, and they end up with oligohydramnion. Those babies who have no kidneys, they have this strong groove under the eyes. This is called the Potter face. Maternal diseases. Maternal diseases, if they are treated well, they don't cause any malformations. But an untreated diabetes and an untreated maternal phenylketonuria may cause problems in the development. Famine and hypoxia doesn't cause any malformations. So the babies, if the mother doesn't have enough food to eat, then the babies may be underdeveloped, they may have small weight, they may be retarded, but they don't have malformations. So also with the hypoxia. So they may be retarded, but they don't have malformations. And now about the twins. Twins may be fraternal or dizygotic twins. This is about 2/3 of all twins. Like all siblings, you may have 2 boys, 2 girls, or 1 boy and 1 girl. 1/3 of the twins, these are identical twins or so-called monozygotic twins. In this case, there was 1 egg cell and 1 sperm cell. And during the further development, at one point, they got divided and you end up with 2 children. This is 1/3 of all twins, and they look very much alike. If this separation is not perfect, then you have the conjoined twins. These conjoined twins, in the everyday language, we call them Siamese twins. Now let's see that what about the fetal membranes and the placentas of these twins. If you have a dizygotic twins, then of course you will have 2 separate blastocysts. They may embed separately, so you end up with 2 amnions, 2 chorions, and 2 placentas. But sometimes it happens that they embed next to each other, and then the placentas may fuse. Even the blood vessels may get connected between the 2 babies during development, and there may be a so-called feto-fetal transfusion. I showed you a placenta with a connecting blood vessel on the first slide of the placenta lecture. Monozygotic twins, how do they form? We have a fertilized zygote, right, in the 2-cell stage, and it may happen in the first days after the fertilization that this in the 2-cell stage they get separated, and from the 2 separate cells you will have 2 blastocysts. In this case, of course, you will have 2 amnions, 2 chorions, and 2 placentas. Most of the monozygotic twins, about 3/4 of these, will form so that when the blastocyst is formed, within the blastocyst the inner cell mass duplicates. What will you have then? Then from the inner cell mass you will have 2 bilaminar germ discs, so that means you will have 2 amnions, but 1 chorion around them and 1 placenta. Right? This separation happens at the end of the first week. If the separation happens on the 2nd week, then within the bilaminar germ disc, 2 primitive streaks will form. And as the 2 primitive streaks form and they fully get separated, they end up with a common amnion, a common chorion, and 1 placenta. This is only in a few cases. And if this separation happens even later than the 2nd week, there is always a greater chance that the separation doesn't run fully through, so they may be connected at one point. When you have the bilaminar germ disc and you have the 2 primitive streaks, the primitive streak will tell that where is the midline. Normally, within 1 bilaminar germ discs. In the midline you will have a primitive streak, and that says that this is the midline. But if you have two primitive streaks forming, then you will have two midlines, and it must be separated along the original midline of the bilaminar germ disc, and sometimes this doesn't separate fully. That's then the conjoined twins. Now, if we think about the twins, just about simple twins, not conjoined twins, that if you have doublets, then you may have them from one egg cell or two egg cells, right? If you have triplets, then you may have them from three egg cells or from two egg cells, and let's say this one is dividing further, and you have a identical pair plus one other fraternal sibling. Or you may have it from one egg cell that first it divides and then later divides it one more time. You can play with these variations also in quadruplets and quintuplets. And remember, I showed you this picture at the beginning that within that quintuplets you had two identical sets of twins plus a third one. So these 5 children, they were formed from 3 egg cells. And here I have this again, that what may happen if an XY zygote starts to be an identical twin, but from one side the Y chromosome is lost, then you end up with a healthy boy and with a Turner syndrome girl in quotation mark, because she's just a girl from the external shape, but she wouldn't be fertile because doesn't have the proper gonad set. Okay. Now, if there is a connection between the circulation of the twins, sometimes one of the twins will take over the circulation of the other twin. Either the other twin will die, or the other twin may be severely malformed, like you see here. It may also happen that the heart doesn't develop, and this tissue mass, which has kind of like body parts which are similar to human body parts, but doesn't have a heart, so it cannot function, of course, and it's not compatible with life, this kind of malformation. If the case is even worse, then not even an entire body, just certain body parts develop. This is Acephalicus acardiacus, doesn't have a heart and doesn't have a head, brain, of course, and doesn't have even the limbs. Now, what are the types of the conjoined, or with common term, Siamese twins? The ones which survive best, those are the Picopagus twins. At birth, they are only 20%, but if you look at that, the surviving Siamese twins, then they give a much bigger part, because they have good life chances. Here you see a pair of twins, Violet and Daisy Hilton. They were celebrities in Hollywood at the beginning of the 20th century. The other variations may be Omphalopagus. These are joined with the bowel system in the belly region, or Thoracopagus, or this may be also combined, Thoraco-Omphalopagus. These give a greater percentage at birth, but these are not compatible with life. These kind of malformations are very, very risky, especially the Thoracopagus or Thoraco-Omphalopagus, because they may have one heart, one severely malformed heart with 5, 6, 7 chambers, and that cannot be operated, so they cannot be separated. Even if they try to separate them, it's sure that one of the twins will die, because from one heart they cannot make 2 hearts. And as I told you, the Picopagus twins are 20%. I just showed you here because you see, as here with the buttocks or with the pelvic sacral region, they are connected to each other. Many times they have a scoliosis. So here you see the signs of the scoliosis. Cephalothoracopagus, they have one head, thorax is joined, they may have 2 or 4 arms and 2 or 4 legs. Craniopagus, the Craniopagus twins, they are not that common, but they also survive quite well. Nowadays, there are methods already for separating them. It's not that easy because not the brains are joined in this malformation, but the venous system here. So they have one skull with two brains, and in between here, the venous system is a common system. And you know that you cannot close out the brain from the circulation for hours during the operation. So that's a very risky and a very difficult part of the operation, how to separate the venous drainage of the sinuses. You remember that in the skull you see the sulcus for the sagittal sinus, etc., and they are finger-thick, big territories. These boys, they got separated. You can find a video somewhere on the internet of them. They were separated in Texas. They were born in Egypt and separated then in Texas in a university hospital. Also here, what I already mentioned in the previous lecture, first they had to enlarge the skin territory with silicone underneath. They stretched the skin, and when they already had enough skin, then they started the operation procedure. It's not one, so they have to do it in several steps. So it's not like they go and they separate and it's finished. It's not that easy. Okay, Ischiopagus twins are connected with the cloaca many times here. Then the external genitalia and the genital organs are also affected. Parapagus twins, they make a smaller person, but they relatively survive well. Parapagus may have very variations. They may have two heads or one head, and two arms and four arms, two legs, four legs. So they have a big variation. Sometimes the separation is even more incomplete. So then there is one almost healthy person with a parasitic twins, or we call this also incomplete duplication. Epigastrius it's also called, so it has many names. Like you see that here something resembling a half of a body is hanging out. Here the other half of the body is hanging out. Or here you see a bar dancer based on the shoe style from the 70s in the USA. She had 3 legs. I find it very sad that it wasn't operated because this can be removed. It's not like that she chooses that on which two legs she is running. She has her own 2 legs which are functioning well, and this one is just hanging and it's just a burden. Actually, what you see here, this is also a parasitic twin because it doesn't have a head, but this started the formation like an Ischiopagus, right? But on this side there is no head. And here then you end up with one child seemingly having 8 limbs, 4 pairs of limbs. So these are here 2 pairs of arms, and these are here 2 pairs of lower limbs. Somehow these type of pictures, if I look for them in the internet, they always come from Far East and many times from India. It's not a miracle because every 6th person is living in India, so of course the occurrence of the malformations may be also higher in that region. And maybe that's also not by chance that in the Indian mythology there are goddesses which have many pairs of limbs. So this already shows that in the mythology, when you have these very special gods and goddesses with a special body shape, or Ariel from the fairy tale, these are based on true malformations, and they all have their embryological background. So some other examples for this, like the Janus god has 2 faces. Right? That's a Craniopagus. Or the centaurs, they may be inspired by Parapagus twins, who may have 4 legs, 1 trunk, 1 head in this case, and just normal upper body half. Or this heraldic symbol, the double-headed eagle, that's a dicephalic Parapagus Siamese twin, conjoined twin actually. And the first best documented Siamese twins, they were born in England in 1100, Mary and Eliza Chuckhurst. They were Picopagus twins. I told you that they have the best chances for survival. And they died at age 34, and on their tombstone they have it written that as we came together, we will go together. They also gave the church their land, and to remember them, they are, because they gave the land, so ever since they remember them, and they are even now remembering them with these generosity cakes, Siamese generosity cakes given out on Easter Sunday. And this village is famous for the bidden maids. But why do Siamese twins die simultaneously? So this is something what I used to ask in the lecture, and then I get all kinds of answers, that blood poisoning and everything like this. But just think it over, that there are two bodies which are connected on a fairly large surface, and both of them have a circulation which has a balance. And if one dies, right, that stops the circulation, and then the other is still pumping around the blood, and actually it's bleeding out into the dead body of the dead twin. So they die because of bleeding out within few hours after the pair or the other pair died. Interestingly enough, though medically it would be possible to remove the dead twin part from the living twin part, it's written that mostly they say that no, I don't want to have it, because they are so much connected that they just accept that they die together. So psychologically, this is a very interesting thing how these Siamese twins function. Then there was a Renaissance surgeon, Ambroise Paré, who in the 16th century, he wrote a book on monsters and marvels, and just imagine that with that time's scientific technique, he collected all the information. So there were not yet big available libraries. There was no internet, and he still could detect all these problems, what I mentioned before, though probably he never saw them himself because they are not that frequent, so it wouldn't be very logical that he just described what he saw. He went after the stories, and based on the stories, he drew all the variations. This was an Italian knight who had a big cloak, and with this he covered and uncovered this parasitic twin and frightened the people around himself. I can imagine that that was frightening when he uncovered this head hanging out from his body. And then Chang and Ang, they are the most famous pair of twins. After them, the term Siamese twin is used even today, because they were born in Siam, Thailand, in 1811. Then an American ship captain took them away with the ship, and they traveled all around the world. They visited many countries, and they were shown for money. And with this, they made a lot of money, although they were denied to enter France, because the French authorities told that they must not, because if pregnant women look at them, they will have similar children. Finally, they settled in North Carolina, and they searched for a couple of nice wives, and here you see the nice wives. They had 2 houses, 2 households, and altogether they had 21 children. 1 week they lived in one house, and then the other week they lived in the other house. And it's told that one of these, I do not know which, I always think that he was a heavy drinker, and he was a very notorious man, and the other was a calm and quiet person. Their connection was minimal, so they could have been separated also with the 19th century technique, especially when they were already older, because there was a skin part connecting them, which got thinner and thinner and longer with time. And through this, also a very, very thin strand of liver tissue crossed from one body to the other body. Tokci brothers, they were living at the beginning of the 20th century. They had artistic talents, no word about what kind of talents these were. They toured, showed themselves, made money with that, and they married sisters and lived 63 years. Married sisters, what counts for polygamy, that how many heads or how many penis you have. So with two heads and one penis, they married 2 women. So it must have been an interesting situation. And two-headed nightingale, they were born as slaves in the United States, but then later they were freed. They were also Picopagus twins, and they were dancing and singing. And at the end of the 19th century, they made $600 a week. So that was a lot of money at that time. And today's most famous Siamese twins, conjoined twins, are Abby and Brittany Hansel. You can find a lot of videos about them. It's very interesting to see also how they share the organs. I will show it on the next list, on the next diapositive. But that's interesting that they have 2 separate heads with 2 separate nervous systems, and one half of the body is regulated by one head, and the other half of the body is regulated by the other head. It's very interesting that how they can run, how they can play volleyball and basketball, how can they drive the car, so they can clap the hands, so they can do everything as you do with your 2 hands. But the 2 limbs on the 2 sides are driven by 2 separate nervous systems. When they ride the bike, they have 4 labyrinths with which they have to keep the balance. So it's a very interesting medical situation also. And here you see the list, how are the organs, you may read it. And next I will show you a short part of this YouTube video about them, that you can see how they move together. So on this video, you see a small part of a YouTube movie about their lives. The twins are now about 30 years old, and they are math teachers. And there are small scenes about their life. If you go to the YouTube and look at this, here watch as they run down on the stairs. Then as they speak, it's also very similar words what they are using. They are cooperating with their hands to make their eggs in the morning, with everything. And with this, I'm repeating that that's very interesting, that 2 separate nervous systems regulate the limbs. They are holding their hands, and they can drive the car. So goodbye for now, and see you in the next semester. Goodbye. Thank you for your attention.